So, how does a nation with over 1 billion people even begin to build a mental health system? Today, we're going to dive into exactly that: the policies, the institutions, and the really cool innovations that are shaping India's ambitious approach to mental well-being.
This quote really nails him. This isn't about finding one single magic bullet. It's about building a multi-layered, interconnected system. We're talking about massive national programs, groundbreaking tech, and the incredible power of community, all working together. Okay, so here's our game plan. We'll kick things off with the big picture vision. Then we'll dig into the actual blueprint, the policies and programs. We'll look at who the experts are, how care gets to everyone, and why it's about more than just treatment. And finally, we'll see how it all clicks together into one big ecosystem.
All right, first up, let's get to the heart of it. Before we get lost in the details, what's the guiding philosophy? What is the core mission driving this entire national strategy?
It all boils down to these three things. Seriously, everything we're about to talk about is designed to make mental health care accessible to everyone, affordable for everyone, and fully integrated into the country's overall health system. Simple, but so powerful.
So, with that mission in mind, let's look at the actual architecture. This is the foundational blueprint, the policies, the programs, and the legal rights that form the very bedrock of mental health care in India.
This whole thing didn't just happen overnight. The story really starts way back in 1982 with the National Mental Health Program, or the NMHP. This was the first major step, the original backbone of the strategy, with the simple goal of making sure everyone had access to at least basic mental health care. And you can see how it's evolved over the decades. It started in '82 with that national plan. Then, in '96, they brought it down to the local level by decentralizing services. But the real game changer? That came in 2017 with a brand new legal framework that changed everything. That 2017 Act was a massive paradigm shift. It put the rights of the individual front and center. It protects patient dignity and their autonomy to make their own choices. And maybe most profoundly, it decriminalized suicide. That was a monumental step toward reducing stigma and encouraging people to get help without being afraid. Okay, so you've got the policies and the laws, but who actually delivers the care? Well, that brings us to the pillars of expertise, the crucial institutions and the dedicated people who make the whole system run. Think of these places as the engines of innovation. Institutions like NIMHS in Bengaluru or the Central Institute of Psychiatry in Ranchi, they aren't just hospitals. These are the places setting the national benchmarks for cutting-edge research, training the next generation, and defining the best clinical practices. But here's the challenge. Brilliant institutions are nothing without brilliant people. To tackle the national shortage of professionals, the NMHP makes training a top priority. It's actively building a bigger, stronger workforce of psychiatrists, psychologists, and nurses to meet the country's needs. So you have these great centers and a growing workforce, but how do you make sure that expertise reaches everyone, from someone in a crowded city to a person in a remote village? The answer is a pretty clever two-pronged strategy: cutting-edge tech and good old-fashioned community action. And this is where digital innovation becomes a total game changer. Tele-MANAS, which kicked off in 2022, is a national 24/7 completely free telecounseling service. The keyword here is access. It uses technology to instantly connect someone in need with a trained professional, no matter where they are in the country.
But it's not all high-tech. At the same time, there's this incredibly vital work happening right on the ground. NGOs and local community groups are essential partners. They're the ones running awareness campaigns, providing local support, and fighting stigma one conversation at a time. So let's see how this all connects for an actual person. Imagine someone first learns about mental health through a local campaign in their town. They can then make a free, totally confidential call to Tele-MANAS for immediate support. And if they need more help, they can get referred to a district hospital or even one of those national centers of excellence. It's a clear, connected pathway to getting care.
A truly great system doesn't just wait to treat an illness, it actively promotes wellness. So now let's look at how India is shifting its focus to prevention and how this all fits into the bigger global picture. And this isn't just an afterthought. Prevention is a core part of the strategy. You can see there's a huge focus on stress management for the general public, plus specific programs designed for workplaces and for schools. The idea is to weave mental wellness right into the fabric of daily life. And it's important to know this isn't happening in a vacuum. These strategies are right in line with the best practices and goals set by the World Health Organization and the United Nations, especially SDG 3, which is all about good health and well-being for everyone.
Okay, we've looked at all the different parts. Now for the big finale. Let's pull it all together and see how these components connect to form one dynamic, living ecosystem of care.
And this is probably the most important thing to get. None of these elements works on its own. They're designed to be an integrated, resilient system where every single part supports and strengthens all the others.
So here it is, the whole ecosystem in one picture. You've got the foundational programs at the base, the legal framework protecting people's rights, the centers of excellence driving innovation, digital lifelines like Tele-MANAS making care accessible, community networks building trust, a growing workforce to deliver that care, and all of it is wrapped in a forward-thinking focus on wellness.
So after all that, it leaves us with one big, powerful question to think about. We've seen a system that's designed not just to treat mental illness, but to elevate mental health as a core part of national well-being. And that really makes you wonder, how does a whole nation's sense of well-being change when mental health is treated as a core pillar of its identity?